Great. Thanks, Suzanne. Hi, everybody. I'm Chris Krasnowski, Executive Director at the Wisconsin Institute for Healthy Aging. So pleased you're able to join us today for this webinar, Bringing Falls Free Wisconsin to Your Community. So the webinar is brought to you by the Falls Free Wisconsin Coalition. We're a statewide falls prevention collaborative made up of local falls and injury prevention coalitions, as well as a variety of community-based organizations, health and managed care groups, public safety, and others who are part of this movement to reduce falls in the state. I know many of you are familiar with the work of WEHA, and if you're interested in learning more about the coalition or the organization, our contact information is going to be at the end of the presentation, so you can contact us if you have questions about anything. We're also going to share a link at the end of the presentation to talk about and to provide you with more information if you're interested in joining the Falls Free Wisconsin Coalition, if you're not already a member. And I'm suspecting many of you are, since you're here on this webinar with us today. That way we'll be able to connect you with, additional learning opportunities, keep you informed on some of the activities and the work of the coalition. So want to thank our sponsors today for this event. It's TRICARE, Inclusa, the Greater Wisconsin Agency on Aging Resources, ARP Wisconsin, TMG, the Managed Group, and Molina Healthcare, and UW Health. Their support sort of throughout this whole Falls Free Wisconsin process has made it a real, the support has been such a help in terms of keeping the funding for the activities that we're doing and a real demonstration of their commitment to falls prevention in the state. So we're really grateful for their support and glad so many of them are here with us today. So I'm guessing that you may already be a Falls Free Wisconsin Coalition member, but you're here because you know that falls are a big problem in Wisconsin, where we now have the highest death rate due to falls-related injuries in the entire country. We get asked that question a lot, why is that? And there's varying answers to that question. I don't think we have data necessarily to support it, but there have been thoughts about whether or not it could be because we have a cold climate and people are indoors more. We know most falls are happening in the home. Could be because of substance issues. We know that Wisconsin ranks fairly high in terms of use of alcohol and other substances. So there's a lot of question marks around why we have the highest death rate due to falls. It also may be because of the way we report about falls in Wisconsin. So I like to tell folks this because we do get that question all the time, and we wish we had an actual answer, but it isn't necessarily because we have a snowier climate and people are slipping and falling outside. So more than 1 in 4 older people have a fall each year. And while we know that falls are a common problem, the headline here is that falls can be prevented. People can take steps to reduce their risk of a fall. And that's really what the Falls Free Wisconsin initiative is all about. So we're gearing up for Falls Prevention Awareness Month in September, and today we'll be giving you a preview of the Falls Free Wisconsin website, share resources so that you can use these tools and resources for promoting this initiative locally and supporting older adults in your community with the kinds of resources that can help them stay safe at home. We also have a special guest today from the Wisconsin Department of Health Services who's going to talk about soon to be released, like minutes from now. I know it's coming real soon, but a report on falls, a trauma report on falls and EMS services. So there's going to be more information on that. So just a word about where Falls Free Wisconsin came from. The initiative was really made possible through federal funding from the Administration for Community Living. Senator Tammy Baldwin forwarded this legislation allowing WEHA, the Wisconsin Institute for Healthy Aging, to create a website with tools and resources for older adults, their families, caregivers, to reduce their falls risk. The earmark funding also allowed us to provide funds to local communities in the form of LEAF grants, LEAF meaning localizing efforts to address falls. We gave out grants this past year in 10 communities around the state for a variety of different projects as part of this initiative. Everything from groups having bingo size classes, which is an evidence-based falls prevention program, stepping on classes, to creating referral systems with their emergency services, a whole variety of different types of projects that were funded. And we hope to be able to continue that into the future. The funding also supports the coordination of the Falls Free Wisconsin Coalition. So that's this multidisciplinary group that addresses public awareness, policy and systems, shares best practices, and helps support local coalition development. There are already a number of local falls and injury prevention coalitions around the state. We're trying to help support those local efforts because really, you all are closest to older adults in the communities and have a really good beat on what's going on in your areas. So again, our great hope is that with this effort, we're going to be able to reduce older adult falls and their implications for families, their implications for emergency services, and for health systems. And with that, I'm going to turn it over to Suzanne to talk a little bit about what we have planned for the Falls Free Wisconsin initiative.
Awesome. Thanks, Chris. So like Chris said, we have this initiative. It started a couple of years ago. It really kind of took steam this past year with the federal earmark that we received to develop this website. So when we talk about Falls Free Wisconsin, we're kind of talking broadly about the coalition, the statewide effort, but then also this website that we're developing. So we know that it's not just going to be us at WEHA doing this work. We're going to need people throughout the state at statewide organizations, but then also local organizations to approach falls prevention and reach the target population, those older adults here. So we really are looking at addressing the root causes of falls, kind of figuring out what that root cause is. Like Chris said, we do have the highest death rate, but there could be a number of different factors on why that is, whether it's a cooler climate, whether it's the alcohol use, whether it's the home safety issues, whatever that might be. So we really want to dig deeper into that. We want to promote programs like Stepping On and Bingo Size that are evidence-based to prevent falls, but then also practices that reduce falls risk. So different practices, policies, and system changes that can be implemented into local communities to reduce falls risk. And then also just instill a belief that falls are preventable. So while we know that falls are a leading cause of injury, hospitalizations, and death in Wisconsin, we know that they can be prevented and we can reduce those risks. One of the first steps that we're kind of taking, and we know that we need to address, is to instill that belief in older adults that there is something they can do to reduce their falls risk. And some of the focus grouping that we've been doing with this initiative, with some of the messaging, we've been hearing from older adults that they believe that falls are inevitable as they get older. It's just something that's going to happen to them as they get older. So one of our first steps is kind of dispelling that myth and then providing education and awareness that there are things that people can do to reduce their falls risk. So what does this look like? This is a really broad-based approach. We're developing a positive, upbeat, kind of you can do it virtual space. So think website when we say that for consumers, so for older adults, to find falls prevention information, strategies, programs, all sorts of things specific to falls prevention. So we have consumer content for preventing falls. We have printable content that can be downloadable. In simple language with easy to follow instructions. There's different resource guides. There's planning tools for safety and mobility around all of the different things that we know that impact falls risk. So strength and balance exercises, vision and hearing, medications, footwear, all sorts of different things. So not only is this for consumers, but also for their family members and caregivers. So we know that not one person can do it. It needs to be really a team approach. So engaging the younger, older adults, so the people that might be taking care of their older family members or parents, and then the caregivers as well, so they know that there are things that they can do to help their loved ones reduce their falls risk. We have a promotion plan, which I'll talk about in a little bit later in this webinar, to make sure that people know about this website. So we're not going to make a difference unless people know that this is here, that this is a tool that they can use. So I'll talk a little bit more about our promotion plan. In a little bit, we are doing paid media, earned media to really motivate people to visit the website. We also have been working on a virtual home walkthrough, which we're pretty excited about. I'll kind of share that later on in the webinar as well. So people can go through a real home in Wisconsin, identify home hazards, since we know that most falls do happen at home, and then learn different tips and tricks to eliminate them and make their home safer. We have interactive quizzes and tools throughout to teach falls prevention strategies. We have relatable stories from real people in Wisconsin that have been willing to share their stories on video and then even just text. So people that have fallen or have had parents or loved ones fall that have been willing to share their story about how it really has impacted their life. And then also provide access on the website to evidence-based falls programs. So different programs that can be implemented locally that older adults in your communities can get to so they can learn even more information about falls prevention. And while we're providing information for consumers, so for older adults and then their loved ones and family members, we also are going to be able to provide technical assistance and resources for our partners. So the people that are here today at the table. So for aging and disability resources, health systems, pharmacies, managed care organizations, public safety departments, and even more people that are working on falls prevention. Since, like I said, we know that this isn't just a WEHA approach. We know that this needs to be spread out throughout the state and through different organizations. So on the website, we have different policies and systems changes that can be implemented in different organizations. So community-based organizations, healthcare systems, clinics, fire departments, things like that, to help people that have fallen or are at risk of a fall. We really want to be a source of best practices and systems development for reducing falls. So learning from what's working in different communities and then sharing it out so people can implement it locally in other communities. Like Chris said, we do convene the Falls Free Wisconsin Coalition to coordinate efforts. So we have a couple different work groups that are working on data mining, policy and advocacy work, best practices, and then awareness as well. And then provide data mining and analysis to help partners really make the case for falls prevention in your community. If you don't know that it's a problem or you don't know the extent of the problem, it'll be a little bit more difficult to be able to say that, hey, we need to be working on this. So we really want to be able to provide local data, county level, and maybe even be able to dig a little bit deeper on what's happening related to hospitalizations and falls, or what's your rate of falls death in your community, so that you can go to your local decision makers and be able to say, hey, this is something that we should put resources towards. And then in addition to that, like Chris said, we really want to be able to provide technical assistance to launch falls prevention efforts in local communities. So we have a coalition toolkit that was developed last year that we have interactive on the website. We are going to be able to provide technical assistance. So if anyone wants to get together in a Zoom call or a phone call or exchange emails and just kind of talk things through on what's worked in other communities for launching local falls prevention coalitions and things like that, we're more than welcome and more than available to do that sort of thing as well. And then also support the dissemination of the falls prevention evidence-based programs. So we do have these programs and practices that we know are working in the community. We know that they're evidence-based. They do reduce falls and falls risk. So we need to spread those out a little bit more. So programs such as Stepping On and Pasando Fuerte. So that's a lot of information, but what does that look like? So I am going to share the website with you guys now. We've been working really, really hard over the past year to develop all the content for it, to talk to different experts, occupational therapists, physical therapists, pharmacists, all these different professions that work on falls prevention to make sure that we have the most up-to-date information on the website. We have tools and resources that are helpful for older adults and for professionals on the website. We're pretty much ready to go with the content. There may be some few minor changes as we get closer to our launching with Falls Prevention Month, but the majority of the information is there. We are still working a little bit on the home walkthrough, and I'll share a little bit more about that in a little bit, but I'm going to show you kind of what this looks like so you can kind of see it for yourselves. Okay. So right on the home screen, we have these this toolbar that goes to different pages that you can go to. These are the consumer pages. So for sound, our surroundings, things like that. We have a welcome message. You can learn more about Falls Free Wisconsin if you click the button. If you go here, you can go to the consumer landing pages. You can go to the home walkthrough. There's some Falls Free Tech Ups. So those interactive quizzes and tools I was talking about, you can go to a Falls Free Tech Up and you can find a falls prevention program there. Throughout the website, we have quotes and videos of people in Wisconsin that have fallen or have taken a stepping on or evidence-based falls prevention program. So we wanted to share that those quotes and different stories throughout. So you'll see those on the website. You'll see that it's a little bit of everything. So we have these buttons, we have these stories, we have videos. So there's kind of something for everyone. It's really a one-stop shop for falls prevention. There's really something that should kind of fit with anyone's different styles. So if they want to watch a video, they can. If they want to read a story, they can. And then we have some different one-off stories here at the bottom. So falls myths and facts, incontinence and falls, and different things like that. And then we'll have a section for people to just subscribe to our newsletter as well. And thank our sponsors at the bottom. I'm going to show a few different pages here so you can really see it and be able to share what's on this website. When you're talking to older adults about the website, you can share, hey, if they're having maybe issues sizing their cane or getting a walker that fits right for them, you can direct them here and there's information on there. So this is our consumer landing page. This is for the older adults and family members and caregivers. And we have different sections here. So I'll go through each of these. We have information on assistive devices, balance and strength, footwear, medications, sight, sound, and surroundings. And I'll click on those as well, but I want to highlight these buttons first. So if you click on the Test Your Falls Knowledge, we have quizzes here people can take. And then this also directs them to NCOA, so the National Council on Aging. They have a falls free checkup that they can take as well to really learn what is your falls risk. Is it low, is it medium and high, just to kind of gauge where they're at. So we have that there. Spot the home hazard, we'll go through our home safety walkthrough, which I'll talk about in a little bit. We have conversations about falls. So this is how to talk to someone about falls, whether you're talking to your doctor, whether it's a caregiver that needs to have a conversation with someone that they're giving care to, or an older relative or parent. There's different guides there on how to talk about falls and how to start those conversations. And then you can read other stories and even submit a story if someone is willing to submit a story about their experience with falls. So then we can kind of gather more stories from people that have fallen. You'll see here, there's a few different stories. There's video stories for people that were willing, just people that really have been impacted by either themselves or a loved one falling. They're really great and able to share and willing to share their stories here. So we have that there so people can know that, hey, I'm not alone in this. This does happen to other people. Other people have gone through this, so they can really have that relative information. And then there's also videos on how to get up from a fall. So you can see here, we have a therapist that created a video on how to get up from a fall. So again, there's different videos throughout. So I'll share a little bit on each page. I'm not going to go through these in super in depth because you'll be able to go through this yourself. But on the different pages for consumers, we have information. So for example, for grab bars, there's pictures on where to install grab bars. And other safety devices. There's pictures in each of these, and there's even some videos too. So how to use a cane correctly, how to use a walker correctly, from professionals right here in Wisconsin that shared those different tips. So hopefully really helpful for people to learn what other assistive devices there are available for them, so that they can stay safe in their homes and stay safe when they're out and about using walking sticks or using their canes and walkers correctly. I'll go through the balance and strength page as well. So I did some interviews with some different professionals too. So an interview with a physical therapist on why exercise is important. And then there's also another physical therapist that created some videos on some different simple balance and strength exercises. So these are 1 to 2 minute videos that people can watch and do these exercises right at home. And you'll see these different sections throughout. So those green ones go to other websites. So medications, that'll go to the medications page right here on our website. There's also resource links to other websites like the National Institute on Aging. And then you'll see a handout on icons here throughout too. So we have different handouts throughout the website. An exercise log that people can download and or print off and use at their own home. And then the balance and strength exercises are even spelled out. So if you don't have bandwidth to watch the videos, or if you'd rather see it kind of spelled out in a step-by-step direction, you can have that as well. And then again, quotes throughout too. Information on footwear and falls, features of safe and unsafe shoes, and then things like yak tracks are things that people can use in the unsafe and icy winters. So I'll just go through one or two more of these. You kind of get the picture of these are pretty interactive. There's videos throughout. There's different resources that people can utilize. They can download them. They can print off. There's a medication record. On this page, there's also information about managing medication safely, calcium and vitamin D, and then alcohol and other substances as well, since we know that that can be a factor for falls. On the sound page, we have information on online hearing tests, which is a resource for individuals. There's a hearing aid guide, buyer's guide, different resources that go to other links. So the Office for the Deaf and Hard of Hearing, the Hearing Loss Association of America, Hear Wisconsin. So you can see that there's really tons and tons of resources on this site to be really interactive and hopefully be applicable for people all throughout the state. That is the majority of the consumer section. So lots and lots of information about all of the different things that can lead to a fall and different ways to prevent them. So I'm going to move on over to the For Professionals section. There's tons and tons of information here that you'll be able to use in your local communities and share with your colleagues throughout the state too. So if you go to the For Professionals landing page, I'll go through a couple of these sites as well. So we have best practices and programs. We have data, how to help by organization. We'll have news and updates. If there's any research that comes out, if we put out some more LEAF grants, those sorts of things will go under there. The promotional resources, which I'll talk about in a little bit. Information on the Falls Free Wisconsin Coalition, our interactive coalition toolkit, and then a request for technical assistance. So I'm going to go through a couple of these pages. So for best practices and programs, we have these really great cards that you can go through and see what sort of evidence-based programs there are that you could have facilitators trained in your local communities. We have physical activity programs, since we know that physical activity can reduce the risk of falls, and then also falls-specific programs. And then we have them kind of broken up by, and you can sort on here by evidence level. So there's some high-level evidence-based programs. There's some that are preliminary evidence, and then some that have no evidence currently. And then we'll make changes to this as needed. There's events on here. There's initiatives and programs. And I'll click on one of these so you can kind of see what it looks like. So it'll give you a brief description of what the program is, what type of program it is, what the evidence level is, what the target market is, the program design. So how often and when, so 1 hour sessions once a week, whatever that might be, what the qualifications for a leader of the program needs to have, and then different website links to go to find more information. Also a section here if it's eligible for Title III-D funding. So for many organizations that receive that funding, if you're able to use that towards the program, and if it's evidence-based for falls. And then also on this website, we have some local examples. So if you're interested in learning more about any of these different things, you can learn more about Mugs for Rugs initiative and different falls prevention events here as well. And then I'm going to show the data page as well. So I'm super excited about this one. I love looking at the data. I think it's super fascinating, and it really does make the case for falls prevention. So we have falls data by county, and this is an interactive map that you can look at the falls death rates from 2016 to 2020. So you can see those darker counties have higher rates of falls deaths. And then if you click on any county, you'll get data for some different categories. So deaths, average cost of falls, and then average rate of fall-related injury visits, so hospitalizations and emergency department visits. And then you can also download the full report here. So that interactive map only has the falls deaths rate, but we also have this data document that you can utilize that has each county broken up for a couple of different time periods and for emergency department visits and hospitalization. So lots of data on this page. And then for other data, if you're looking for some other data, we have links to the CDC page that has some additional data, and then a couple other data systems, and then of course, just some limitations about data. And then this infographic here kind of displays the fall situation in Wisconsin. Like we said, we have the highest death rate, and then over 1 in 4 older adults has a fall each year. So hopefully some really helpful and useful data to be able to show in your communities. The How to Help section has information for different organizations on what they can do. So for pharmacies, public safety, fire and EMS departments, occupational and physical therapists, community organizations. And you can click on these depending on what organization you're with and find different policies, systems, changes that you can implement. The study algorithm from the CDC for falls prevention, what things you can do. So you can refer patients to a pharmacist for a medication review. You go to the pharmacy section and there's medication review information here. There's information about evidence-based programs that you can review with your clients. There's information on different system examples that have been implemented throughout the state. So for public safety, there's a referral system example from Brown County with the ADRC that there's different resources. You can take these policies and tweak them for your local community if that's something that you're interested in. For community organizations, how to leverage health department data, how to plan a falls prevention event. And then there's also a sample community presentation there. Different things all throughout here. So hopefully this is helpful for if you're kind of new to this, or if you're thinking, hey, what else can I do in my organization? You can check this out to find some helpful tools and resources here. I'll go back to the promotional resources in a little bit, but I want to touch on the Falls Free Wisconsin Coalition as well. So we have information on our coalition here. There's a link to join the coalition, which will also be shared at the end of this webinar. There's a link to our webinar series, which there's a few different webinars that are on there that have been held within the last couple of years. You can see our coalition organizational structure. And then if you're interested in linking up with other falls or injury prevention coalitions, there's links here to some different organizations that are working on falls prevention throughout the state. So you can kind of see if you want to connect with any of these individuals to see what worked well for them, you can do that. Cool. And then along the same lines, under our Start a Coalition section, we have developed this Coalition Quick Guide last year. We kind of took this toolkit. Not everyone wants to read through all 18 pages of this, so we made it more interactive. So you can go to each section depending on where you're at in your local community. If you're in the formation state, if you're in the launching or maintenance state, you can click here throughout the toolkit and see different resources for getting started, different tools here, the benefits of starting a coalition. There are sample agendas under these different sections, how to make the case for falls prevention in your local community. If you need to get some buy-in, how to create a planning group, all sorts of different things here. So how to plan a kickoff meeting, how to recruit and engage coalition members, and things like that. So hopefully a really helpful section here if you're looking at starting a coalition or rebuilding a coalition, or just kind of upping the capacity of your existing coalition. Under technical assistance, you'll find just a quick technical assistance section that you can submit, and someone will get back to you from the coalition or from WEHA within 2 or 3 business days to describe what you want assistance with, whether that's a referral system, if you want to connect with people that have done referral systems, if you want to connect with other coalitions, different things like that. If you're looking for a specific presentation that you're wondering if maybe someone else has, so you don't have to recreate the wheel, we're more than happy to help with any of that too. And then we also have here, which I'll talk about a little bit later on in the webinar, is the promotional resources. So how to bring Falls Free Wisconsin to your community. So we will have a media promotion partner toolkit, and all of the resources will be on this website. So already available are our newsletter articles and our different couple of things here, but I'll talk about that in a little bit. So another thing that's kind of like something that we've been really excited about sharing is our home walkthrough. So we are still a little bit in the planning stages of this, kind of tweaking some of the home walkthrough right now. It's taken a little bit longer than we anticipated with some more challenging coding and all those sort of technical things that I don't understand anything about, but we're working with our team that is helping us develop our home walkthrough to have it be available as soon as possible. So I'm going to show you what that looks like. Just a disclaimer that it's not quite ready yet, but I really just want to be able to show you that so you kind of have a better understanding of what that's going to look like. So we did stage a real Wisconsin home with some falls hazards, and then we're really making this into an interactive game for older adults, but then also for their family members and caregivers to go through so you can see, hey, this is a fall hazard in my home. Maybe I should do something about that. Or, oh, I didn't think about that. Maybe I can add this grab bar there or something like that to help make your home safer. So like I said, it's not quite ready yet, but I'll just kind of show you a little bit of that. Super excited for that to be ready. Think of this as we kind of modeled it after if you're looking for a home, if you go on Zillow or any realtor websites, you can go through that interactive home look through. So we really modeled it off of that, but just kind of testing some of the usability with some older adults to really make it more simple. So we're even working on some changes this morning. So again, this isn't the final draft, but just really want to show you what it looks like. So again, this is a real Wisconsin home that we staged with falls hazards. We'll have an introduction and a description page before anyone even gets to this, so they can understand what they're getting themselves into, what different sorts of things that they'll be able to do and how to navigate it. But then also available will be some tips and hints. So if anyone's kind of stuck, they can click on this to figure out, oh, I need to do this to be able to find the fall hazards or something like that. We also have this house floor plan so you can kind of see where you're at in the home because we did stage the whole house with some falls hazards. You can go to the garage, the kitchen, the laundry room, the basement stairs, the dining room, the living room, the foyer, and then the bathroom as well here. So I'll just kind of show you what this looks like. Again, this isn't finalized, but we're really excited to be able to bring this to a local community. So basically you'll be able to go through this home. It'll direct you different ways. You can go 360 view to be able to find other falls hazards, but you'll click on hazards, they'll light up, and then you'll get a pop-up that comes up with what to do about this fall hazard of what the tip is. So lighting, make sure you have bright outdoor lighting, especially at night. Another thing is the threshold. If it's an unmarked or raised threshold, watch out for that. Mark the raised threshold with bright paper paint if possible. So clutter, you'll find that. And then you can see here on this right-hand side how many hazards or tips there are. So there's 10 on this outside section, and I found 3 so far. You need to find some more, and you can kind of see things kind of pop up as you hover over. So finding all of these, you can see it keeps counting over there. I know where all these are already, so just gonna kind of squeeze through this. This is what we plan on having the rest of the house look like as well. We do need to test some of the other functions of this home walkthrough, like I said, before we are ready to publish it and have it be ready on our website. But I'll kind of show you the inside too. So that'll be what it'll look like throughout the house. So click on the fall hazard. You can go to other rooms. You can twist around to the 360 view, find all of the hazards here. And then you'll get a helpful tips and hints that'll pop up along the way. And then when someone is done with this home walkthrough, they'll hit the quit section and get our fall hazard checklist. And then also be directed back to our website. So really excited about this. Like I said, we just have a few more bugs to work out before we're ready to publish that.
Suzanne, just to quickly mention that people do get hung up. There's a place where they can find hints. and something will pop up that will hover over the general area, as you can see here. If they're really stumped and not sure, and they see, oh, there's 10 hazards, but I've only found 8 of them. The hints will help them identify additional ones. And then, as you probably heard, there's a little bell that goes off, so people know when I found the hazard, and it counts into the counter here under home hazards and safety tips. The other thing just to note is that you'll probably have guessed here, some of the hazards are visible, and some of the hazards are things that are not there. As Suzanne's pointing out, there's no railing here. So when it pops up, it'll say this is missing. There should be a railing here for safety. So some of them are things that aren't there, and the hints will help people identify those things that are missing from the space.
Yeah, thanks, Chris. I missed that. Okay, I'm going to go back to the presentation now so you can kind of talk a little bit more about the promotion plan. So really how you can bring this to your community. I apologize while I scroll through quick. Okay. So with our promotion plan, we've been really planning for this in the last couple of months to generate traffic to the website. So we'll do a soft launch of the website towards the end of the month, but then really start to drive people to the website this September. Kind of works out perfectly since it's Falls Prevention Month. And our target audience is the older adults, but then also their family members and caregivers who might be driving some of the conversations around falls prevention. So we are developing some partner resources. Some of this has already gone out. Like I said, the newsletter articles were sent out since we know people have some deadlines a little farther in advance to get them in the September issues. We have press releases that we're sending out. So we have press release templates. These are the newsletter articles that you can put into your local newsletters. We have one for consumers, but then also for professionals. So if your organization has a newsletter that's sent out to professionals, whether that goes to physical therapists, fire departments, or if this is just an email blast to make other individuals throughout the state aware of the resources, we have templates for that. We have templates for letters to the editor. And then we're also developing a media plan, so a social media plan with different graphics and then suggested messages that you can post on your social media channels. We also have a Falls Free Wisconsin Facebook page that we will be posting on and welcoming individuals to share the pages or the posts from our Facebook page onto your own Facebook page. But we will have this media plan that you can schedule posts out throughout the month of September to really direct people to the website as well. And then we have consumer handouts. So this is a document that we developed that you can cut into 4 different sections. So you have just this quarter page handout that has the QR page for the website, but then also the link for the people that may not use the QR code, just to hand out at events, hand out at meal sites, hand out at pickup calls, whatever you might be doing in the community to get the word out about the website. And then also developed radio talking points. So for individuals that go on your local radio station, you can use these little talking points, talk about the fall situation locally, talk about what's happening in Wisconsin, and then drive that home to the message of this is Falls Free Wisconsin, this resource is here to help you. And then all of these different resources will be packaged in our media promotion partner toolkit. So we will be pushing this out towards the end of the month, just kind of waiting on the home walkthrough language, since that is mentioned throughout a lot of these different articles on when we're ready to have that available for individuals. But you will have all of these different templates to be able to promote Falls Free Wisconsin in your community by the end of the month. So we're really excited to be able to provide those for you all. We'll have the logo available if you want to add the logo or QR code to your own existing website. So then you can kind of link that to your falls prevention efforts locally and then the statewide effort too. And then as that we'll also be doing some earned media, so different events with some of our partners throughout the state. So we are planning on going to some of the larger media hubs to promote Falls Free Wisconsin. somewhat with our LEAF partners. So the grantees that we gave grants to at the 10 different organizations will be partnering with some of them, and then partnering with some other events that are happening throughout the state. So we'll be in Oneida County talking about the Stepping On workshop that they have. We'll be in a couple of different counties talking and at their falls prevention awareness events. So bringing in their coalition members, bringing in their decision makers, their local people that have fallen or have taken an evidence-based program in their community to talk to the media and then link it back to Falls Through Wisconsin. And then we've talked a little bit about bingo size. So we gave some LEAF grants to some bingo size, to some organizations to implement bingo size. So we'll be talking at a couple of bingo size classes too. So we'll be out and about throughout the month of September, really heavily promoting this to really drive traffic to the website. And then we'll also be doing paid media. So we're working with a vendor to launch some campaign ads. So we'll have some video ads on services like Hulu, Disney Plus. We'll have some audio ads on services like Spotify. We'll have additional social ads that our media vendor is developing for Facebook, Instagram, and Pinterest. And then we'll also have email, search ads, and then our digital handout and press kit for the partners. So I'm going to show an example of what the video ad looks like. So kind of what our campaign theme and message is. This again is a draft ad. There are a couple of changes that we're going to be making to this ad, but just kind of wanted to have you all get a feel for what this our little 30-second ad will look like.
Fall for your sweetheart.
It had to be you.
Not over your rug. Falls happen in a lot of ways. You can take steps to prevent them as you get older. Visit fallsfreewi.org to learn how. Find the fall hazards in our interactive home walkthrough. Discover what factors can lead to a fall and how to fix them. Stay safe with Falls Free Wisconsin.
Again, just that short little ad will go out to some of the streaming services like Hulu, Disney Plus, and then also be available potentially to distribute on Facebook pages as well. So that's our plan for media promotion. Chris is going to talk a little bit about sustainability of Falls Free Wisconsin with the Healthy Aging Grants.
Right. Yeah, and just to let you know, like that's our first ad. We're going to be putting together several others with some similar hooks to them, but liking the idea of, you take a trip for fun, don't trip over your rug. Like we're doing some of that kind of wordplay, and we'll have a variety of other looks at that. So we're kind of excited about that. The placement, we're talking about placing on streaming services is going to be targeted at older adults and family members. So just so you might have thought Disney Plus, huh? Is that where we're going to reach older adults? There's ways to target this to make sure that we're reaching people who are viewing in Wisconsin, viewing specific programming on some of those streaming services. So just so you know, we're kind of carefully thinking about and planning that to make sure we're reaching these target audiences. But we also recognize too, it's not just older adults. We know that family members and caregivers really drive a lot of the support for older adults, particularly as they become more frail in the home. We want people to stay at home and independent as long as possible. So we see that there's going to be different audiences for this, and we're recognizing that and wanting to make sure that we're reaching varieties of folks. So on to the Healthy Aging Grants. This is, we have been working toward some state level funding for Falls Free Wisconsin for a while in this past state budget, which you may be saying, aren't we done with that? Yes, and the governor had put money into the state budget, $1.2 million over the biennium to support what's called Healthy Aging Grants, something that had been in the budget in 2015, but had sunsetted out of the budget and had not been in the budget since that time. So fast forward to this year, those Healthy Aging Grants were stripped from the budget as the Joint Finance Committee took up the budget, the full budget. but not willing to give up. We have met with some state legislators and requested that they consider a separate bill to support the healthy aging grants. And what this really would do is provide $378,000 a year for 2 years, so a total of $756,000 over the biennium to support Falls Free Wisconsin and other evidence-based programs that WEHA offers in chronic disease self-management, physical activity, but all that support older adults in the community and ensure that people are able to age well and independently. So, but predominantly, I will say, in talking with legislators, what their main concern here is that we support falls prevention. There's a lot of sort of enthusiasm around this in light of the fact that we know that emergency services are really strained with the numbers of older adults that they are seeing, the number of runs that they're making, the number of lift assists that they're doing, the number of transports that they're doing for older adult falls. So in partnership with other organizations out there, the Wisconsin EMS Association, the Firefighters Association, we're really working together to try to encourage funding. If we are able to get this additional funds, we will be able to offer more LEAF grants in the future, provided we have this level of support. And this supports the organization providing training and technical assistance and all the resources that you've seen here, the maintenance and management of them. And probably the most important thing, the outreach that we know we need to continue to do to be able to drive people to these resources. It's certainly not enough for us to create this, sort of treasure trove of tools and resources for people in the community and for professionals. It's what's really critical is making sure they know about them, how to access them, and they're usable to people. So the education process will continue to go on and on. So currently today, we're awaiting a bill number. We have 2 legislative sponsors, Senator Fine from Oshkosh, Senator Rosar from Marshfield, the Marshfield area, are in the Senate and the Assembly sponsoring this legislation. My message to you is that if you are so inclined, we would encourage you to contact your local legislators, your state senator and state representative, ask them to support the Healthy Aging grants. There'll be more information coming out about this, and I'm glad to answer questions if people have them. But again, the real point of this is to be able to provide continuous support so that we can keep Falls Free Wisconsin available, accessible, continuously updated and improved. And with that, I'll turn it back to you, Suzanne.
Thanks, Chris. All right, and we are gonna stop talking for a little bit and allow Will from DHS a little bit of time to talk about some state falls data and reports. Will, did you need to share your screen at all?
No, that's all right. Thank you, Suzanne. Good afternoon, everyone. I'm Will Kane. I'm an epidemiologist with the Office of Preparedness and Emergency Healthcare here at the Wisconsin Department of Health Services. Our office deals with a lot of the EMS programs. We work to license them and help them run and collect some data from them on the ambulance runs that they go on. And we also house the trauma care registry, which collects information from our hospitals that are leveled trauma centers. And so we can get a little bit of insight there into what sort of traumas they're seeing and help them with their own quality improvement too. We have 2 big reports that I wanted to talk about that are coming up that would be of use to a lot of folks. And WEHA is partnering with us on the promotion of these, which we're really excited about. The first one is the 2022 Trauma Year in Review that has a focus on falls section. It has a bit more information on the trend in falls that we've seen in the trauma registry over time and where we're seeing these falls happening in our community in the trauma system. And the second report is the EMS and falls in Wisconsin report, and that has a bit more information on where EMS is responding to falls 911 calls in Wisconsin. In this EMS report too, there's a couple of really interesting pieces. One of them focuses on counties with high numbers of repeat calls. We see we hear a lot from our EMS services on individuals that fall and need to call 911 to have EMS help them get back to their feet or bring them in to the doctor, and are folks that do this often, meaning that they don't have the resources that they need, or they're not able to access those resources for some reason. And so we are trying to highlight some of the areas of the state where we're seeing more of these, so that our partners like WEHA and others can try to focus in on those areas. Additionally, when you're looking at these reports, we'd like folks to keep in mind that EMS can be a great resource to partner with when it comes to preventing falls. Here at the state, we're doing a lot of work to try to increase the amount of community EMS programs that exist, and community EMS really exists to help connect folks with other healthcare services or other services that will help them improve their health and well-being, so that they don't need to call 911 as often. And so that's something that is an exciting development here. And we'd encourage you to reach out to your local EMS services and see how you can help them, and how they can help you when it comes to fall preventions. So look forward to receiving word on those two reports. They're finalizing our press releases for them, and so they should be coming out soon. You may see it coming from us or from WEHA. So we'll be excited when those are out. And if you have any questions, there's contact information in those reports. And if you have more data questions or data needs or questions that you think would be helpful for you, your organization, your jurisdiction, or the state as a whole, definitely follow up, and we'll see if those are things that we can look into. So thanks all for letting me talk briefly on this call today.
Awesome. Thanks, Will. I really appreciate it. Just to kind of get an overview of what's coming with those reports, and just to talk a little bit about that community EMS program. We did host a public safety and falls webinar just a few weeks ago, where we had an organization talk about their community EMS program. So if that's something you're interested, definitely check that out. It is in our Falls Free Wisconsin webinar series, which I had that link on the Falls Free Wisconsin Coalition part of the website. So definitely check that out. And then if you haven't already, join the Falls Free Wisconsin Coalition. And I'm sure once those reports come out, we'll definitely be sending out the links to them through the coalition if you don't receive them through other places. So again, just wanted to thank you all for joining us. The links on the screen and the QR codes on the screen, the top one is for joining the Falls Free Wisconsin Coalition. And then the bottom one is for the fallsfreewisconsin.org website. So we're not quite ready to start publicizing or publishing and promoting the website yet, but we'll be doing a soft launch next week where you'll be receiving that link. So you are welcome to go to it right now. The link is live. The only thing that is still kind of under construction is that home walkthrough page. So you are welcome to go to that, kind of check it out. Check out the resources, provide your feedback. My email is on the screen too. So if you have any questions or want to provide any feedback, definitely shoot me an email. I'm more than happy to receive that feedback. So we do have just a couple of minutes for questions as well. So if anyone does have any questions, feel free to come off of mute or share them in the chat.
I will quickly say one of the things that we're going to be very interested in following up after sort of we get through September and kind of get the thing launched, is to find out a little bit more from you all, if and how you're using some of the resources and what it is we can do to perhaps better tailor them to you, or find ways to adapt them to different uses. So just wanting to raise that so you can kind of keep that in mind for down the road. Just be thinking about what it is we can do to help support you more locally and how these resources are being used by you and your communities. I see there's one question from Amanda. When are you planning to post the press release and additional promotional tools on the site? ASAP, Amanda. We're a lot of them are kind of there right now, several of them. We're just finalizing the press release, and our press release and the DHS press release has some of the same content in it. So we want to make sure that we're kind of coordinating. So we're kind of just waiting to make sure that we have everything pulled together fully before we pop it on out there. But there'll be the press release, there'll be a letter to the editor that you can customize and use also in the community. So as fast as we can, and anything we don't have ready, we'll sort of keep back until we do have it ready, and we'll get everything else out no later than the end of the month.
The resources currently on there are the newsletter articles and that quarter page handout. So those are on there readily available and ready to be used. And I see another question on what day does the site go live? So it is currently live. You are able to go to it. We're kind of in the soft launch section. We'll be sending out the website link to our coalition partners and a few others next week, and then start the heavy promotion of it early September. So it is live. It is ready to be visited, just not for that home walkthrough section yet, quite yet.
And your feedback is really welcome. We would really love to hear anything that you, or if you find anything that you're like, oh, you sure? Or there's a typo or something like that, we're looking for any and all kinds of things along those lines that we can improve the site. Any sense when the DHS reports will be out? I know, Will, it's like really close, but I don't know if you have a date.
Yeah, I don't have a hard timeline. We're supposed to get the specific date later this week, so I'm guessing in the next week or two is when they're planning on releasing it.
Okay, I'm gonna type my email in the chat. So like we said, if there's any feedback, any additional resources, any typos, feel free to send all of those my way. And I'm going to launch a couple of polls as well. So just to close out again, thank you so much for joining us. Thank you to our sponsors for supporting this webinar. And I'm going to launch a couple of polls. So it looks like I'm not able to launch polls right now. Sorry about that. I think I got logged out. All right. Well, again, just thank you for joining us. Definitely provide feedback to us throughout the website as you're looking at it. Feel free to go to it right now. Shoot me an email today even. I'm more than happy to make any changes and suggest have any suggestions come my way.